today. Anyone dealing with obesity will tell you they do just about anything to be an ordinary size. You may have seen one of our next guests on the TLC groundbreaking documentary, Half-Ton Mom. Please welcome Dr. Clifton Thomas, along with his patients and success stories, Dottie, Lucas, and JB. All right, Dr. Thomas, you've also written this book, Skinny Jeans at Last, but this is not about being skinny.
That's right. So I'm proud of this book. I wrote it to help people with long-term success. And really, the skinny jeans is a metaphor for what it's like to lose weight, what that feels like emotionally, to be able to walk into Victoria's Secret and buy a bra off the rack for the first time, for example. That's a big emotional event. But also, you know, really that translates into what it feels like to become healthier.
All right, Dottie, for all of you, you were always told, yeah, you got to eat right. Eat right and exercise. That's the answer to it all. Easier said than done, as is witnessed by the problem that we have in this country. But what was the point where you said, I have to take a chance on life now?
Yes,
and how bad did it get?
Well, I was overweight my whole life since I was like 7 years old. My whole family was as skinny as you. I mean, so it was
just I was skinny.
So it was just you know, it's a generic thing and genetic thing. And so I knew my health was good, and I was a diabetic, high blood pressure, and I just knew, you know,
quality of life was going away.
Yes, you know, and I was a school teacher, elementary school teacher. I wanted to get down on the floor with my kids, and so I'd heard about Dr. Thomas and had several patients go to him and raved reviews, and so I did it, and it was the best thing I've ever done.
All right, and you have the pants with you?
I have my pants.
With the elastic?
Yeah.
Wow. Okay, the point you said enough is enough?
Imagine when I couldn't tie my shoes no more.
Something as simple as that. Yeah, you have to start like dancing around even the clothes that you normally would wear. And so had you tried the other things of the diet, the exercise?
I tried everything my whole life. I've been big my whole life.
Yeah, look at that picture there. You're a completely different person. And for you?
For me, it came whenever my regular doctor wanted me to start taking blood pressure medicine and trying to get it under control, and I decided that 21 was too young to be taking
21
blood pressure medicine. Yeah,
and then things that also follow, like what we used to call adult onset diabetes that now we just call type 2. Look at that. We just call it type 2 now because so many kids are in that. All right, so this is not just about aesthetics. This is about, as we say, health, and for other people looking in saying, you know, just do the right thing, eat and exercise. Harder than just said, and it costs all of us if folks can't get a handle on their weight.
Well, nearly zero can lose 50 to 100 pounds and keep it off long term. There's not a study anywhere in the world where that's been accomplished. Medical weight loss has only been able to accomplish 10% of excess weight loss. So if you're trying to lose 100 pounds, that's only 10 pounds long term that's ever been proven. So people, if you're carrying that much extra weight, you need a tool, and that's what weight loss surgery is. And the reason why you need that is because there's all these chemicals in our body, biochemical pathways that are working against us. And you can't change that.
All right, and just Dottie, I want you to stand up because you're really petite.
Yes.
And you've lost 100 pounds. Let me just give it how tall, how petite you are. You lost 100 pounds.
Yes.
You lost 134.
No, I lost 192.
192. Oh my gosh, 192. And you lost
134.
134. All right. That's incredible. All right, you can sit back down. Tell us exactly how that surgery works. I know there's different types of bariatric surgeries.
That's right. So Dottie had a gastric bypass, Lucas had a lap band, and JB had a sleeve gastrectomy.
Okay.
So the three different operations. So the gastric bypass is kind of the gold standard. It's been around for a while. It bypasses part of the intestine, which it changes those chemicals in our body that are driving us towards food just by bypassing that area. And with each one of these operations, you have restriction. You can only eat about 4 to 6 ounces at one time before you get full. So all three operations accomplish that. The lap band doesn't, because you don't really, the lap band is a little inner tube that you put around the top part of the stomach. So you don't get these chemical changes in your body that you do with the sleeve gastrectomy and the gastric bypass. But you do have restriction. So a person that can be very successful with lap band is exactly like Lucas. Lucas cruised with this. He just, every time walked in, just losing weight, no problems, nothing to even hardly talk about. And it's because Lucas is a very good planner in his daily life. And so he's found with a lap band that to be very easy. But most of us don't live that way. We live a very haphazard life. We want to do better each day, but we you know, we
Yeah.
don't accomplish it.
Yeah.
The sleeve gastrectomy is very much like the gastric bypass. It's a less complex operation, so there's less complications with it. We now have good 5-year studies, and they looked at it, the 5-year studies show it to be as effective as the gastric bypass. So now, at least 80% of what I do is sleeve gastrectomy, and people are doing very, very well with that operation.
And there has to be some kind of discipline that goes along with it, but basically what it sounds like what it does is that it forces us to eat the way that all of us should really eat, and those are smaller, nutrient-dense meals throughout the day.
Exactly. This is nothing more, each one of these operations is nothing more than a tool to help you eat the way we should all eat.
Yeah, and it ultimately save lives.
And
so
by the way, that's
congratulations.
in my book, by the way, how to eat.
How to eat. All right. By the way, everyone in the audience is getting 2 of Dr. Thomas's books. Now, why 2 is 1 for you and 1 to share with somebody. And Dr. Thomas also has a special deal. He is offering Great Day viewers a free consultation. Just give his office a call, 713-936-0777, 713-936-0777. That way you can figure out if you qualify for one of these procedures and which procedure would be best for you. And for more information on the book and all the procedures offered through his office, log on to obesity-control.com, obesity-control.com.
Control-obesity.com.
Oh, wait, say it again.
Or CliftonThomasMD.com. Control-obesity.com.
All right. Thank you very much. And you